This is my person. Okay. Good morning. I'm Leanne and I'm going to talk about COVID-19. To start off with about COVID-19, imagine being in the 1300s when the Black Death and pestilence hit Europe. Back then, people did not understand how the diseases and viruses spread. However, knowing what we know now and ignoring the proper precautions is a danger to our society. While COVID-19 is not as dangerous as the Black Death, it still poses significant risk to the human population, and that being said, people aren't adhering to the CDC's recommendations and are causing the virus to spread and harm individuals. Because of my experience with working in the front lines and having followed the guidelines of our hospital and the stay-at-home order, I speak to you today to make sure you understand the seriousness of COVID-19 and the importance of social distancing. The following points will be made. COVID-19 is: what is COVID-19? How is it spread? What likelihood of death? Potential impact, and how to protect ourselves and others. Okay, what is COVID-19? It is a disease spreading throughout the world and is spread by person to person, according to the CDC guidelines. Some of the symptoms are respiratory viruses. It is like the flu, but it is more serious than the flu. You can contact it a lot easier. It's related to the common cold, and it causes viral pneumonia. How does it spread? It can spread by droplets. It can hit the floor. It can hit the metal. It can be on your shoes and your hair if a person coughs, sneezes, and you can inhale it through your lungs. You can breathe it in if you are in proximity with somebody. If you touch a contaminated surface, please do not. You can touch your eyes, your face, your nose. You can get it by that, in your mouth. So those are just some of the things how this virus is spread. The potential impact that this virus has is mainly on the elderly who are chronically ill, patients that have COPD, emphysema, a chronic illness, are more susceptible, and they usually end up on ventilators, and after that they end up dying. And this is the difference between the COVID-19 is a difference between the flu, the cold, allergies, and the flu. Problems that this causes along with social distancing: people not staying home. People going out in crowds, like at a park with 100 people. That's not social distancing people. Social distancing is where you're supposed to stay on 6 feet away, go into your home. They say you can go out for a drive, go for a walk around your block, go get your mail, and then go right back home. Most of this, with not social distancing, there's a lot of people that have died because of this disease. And it spreads a lot faster. During our isolation, even though you're at home, some people just have heart problems, depression, dementia. A big thing is stress, because everybody's so worried about it, they don't know what's going to happen. During social distancing, we feel alone, isolated, and the concern about this is when they finally do lift the in-home stay, they're afraid that people are going to back away from reconnecting. Instead of reconnecting, everybody's just going to stay in their homes and avoid hugging and stuff like that. But they say in order to stay connected, make sure you video chat or Skype with family or friends. A new plan is by the ccd.org or the khd.org. They mandate quarantine of isolation if you've been to Florida, Washington State, Colorado. If you come from one of those places, you have to do a 14-day quarantine, or if you are testing sick. How to protect ourselves and others from tlmch.org is wash your hands, antiseptic lotion. Add masks, which is effective immediately in my workplace. How to protect others. Cover your cough. Cough when you're wear a mask. Wash your hands, stay at home, don't go to work, don't rush to the doctor's office. The standard treatment is that stay at home except you need to get medical attention, monitor your symptoms, get lots of rest, and stay dehydrated is the most important. And this is the mask precautions. Now I'm going to talk about the total confirmed COVID-19 deaths rolling in a 7-day average. Well, statistics of COVID deaths in the world. As you see, Europe has 80,000, North America has 160,000, and South Africa, Oceania, and Africa have 180,000 deaths. Total confirmed deaths rolling in a 7-day average. As you can see, Korea has 0. United States, we've only had 8. Italy has had 14. Spain has 18 and plus, and the United Kingdom has had 13. So those are the total deaths in an average of a 7-day period. And the total confirmed in the world from December 31st to January of 2020 were 20,000 deaths. From March 1st to March 21st, 180,000, and April 23rd of 2020, daily deaths were very little at the time, which is a good thing for us. What can we do to minimize the spread of the virus? Listen and understand, do your part in social distancing, make sure you do proper hygiene, wear a mask, learning and keeping up to date, doing all the things planned to decrease the infection. My conclusion that you've learned from me while I'm informing you of COVID-19 and pandemic, how the guidelines that the government kept, Governor Kelly, KHD, and CDC have placed. Make sure you minimize the spread of the virus. Social distancing, and that is the most important time maybe we could have avoided. The stay-at-home order. If it goes over, I'm not worried. My hope is that you've learned to realize how important it is for us to take action sooner rather than later, and that understanding the severity of this will help out in many possible ways. And remember to thank all the essential workers and all healthcare workers. Not all heroes wear capes.